Thanks everyone for joining. We'll be starting in just a minute. So again, I'd like to thank everyone for attending this afternoon, evening webinar. And the webinar is basically designed to give you updates on several of the DCM Foundation GCAC projects that we're working on. One note is that all participant microphones are muted, and please use the Q&A feature if you have questions. Next slide, please. Again, as I mentioned before, we decided that this would be a great month to do an update webinar on several of the important and key projects that the DCM Foundation and the Genetic Cardiomyopathy Awareness Consortium are working on, and to answer a lot of questions that each of you we've been getting online about these projects over the last few months. Next slide, please. Please submit your questions. We want to make sure, as I mentioned before, that you enter your questions in the Q&A feature of Zoom, normally at the bottom of your screen, during the presentation. Tonight, we're going to do things just a little bit differently than we have before, and we have 3 distinct section speakers, which I'll introduce in a moment, and we're actually going to do Q&A at the end of each section. So if you're listening to a presentation, if you have a question, please input it in the Q&A box, and because we're going to have 3 separate Q&A sessions. Note again that all microphones will be on mute. Next slide, please. So Justine, if you could help cue the poll. And poll is, who is attending tonight's webinar? Are you a cardiomyopathy patient, family member or friend, medical professional, or industry professional? Please submit your answer now. And we'll give you just a few minutes to take a peek at that. Please submit your polling answer now. And Justine, would you please show us the results? So great, 60% patients, 12% family, friend, 10% medical professional, 19% industry professional. Again, thanks so much for attending tonight, and we're glad that you're all here. Next slide, please. Again, we'd like to thank all of our partners of the Genetic Cardiomyopathy Awareness Consortium, other groups like the DCM Foundation, in helping sponsor and support a lot of the programs that we have at GCAC. We appreciate everyone and all of these patient groups participating with us. Next, please. Also, and I think we mentioned this last webinar, we're really excited about this. So I'll mention this at the end of the webinar, but you will get a recording of the webinar a day or two after this evening. And beautiful thing about these webinars now, it is stored in YouTube, and we'll have links to be able to get to these to the webinar to view it. But with YouTube, you also have the opportunity to listen to the webinar in up to over 100 different languages with auto translate. How to get there is you just simply click on the GCAC site, as you can see here on your screen. Go to resources at the bottom. It says archived webinars. Jump on that, and you can play the webinar. And if you would like to select a different language, or if you'd like to send it to a friend that does not speak English, there's real simple, easy instructions on how you play each webinar, each archived webinar in a different language other than English. Next slide, please. So tonight's agenda has got 4 topics, 3 sections. The first is addressing the FAQs about the Genetic Cardiomyopathy Registry. And that was our sort of January webinar. Had a lot of success with that, very well received. But we're seeing some reoccurring questions in our info email system. And so we wanted to get back online to talk about that and answer questions that you have. We also are going to talk about our gene-specific groups and what their role is in supporting patients. And then I'm going to talk about ways you can help us reach and support more patients and getting the best care possible. Next slide, please. Tonight's presenters will be me, and everybody knows probably on here a lot about me. I don't need to talk any more of that. We will also have Shauna Planck, which is a lamin patient, and her family has a long history of genetic cardiomyopathy and transplant. And she is the manager of our Genetic Cardiomyopathy Registry. And then we also have Christy Johnson, which has the DSP gene, which manifests as arrhythmogenic cardiomyopathy and dilated cardiomyopathy. And Christy manages our gene-specific groups, and she will talk about that and give you more information on that. And now I'd like to turn it over, next slide, please, to Shauna Planck, and remind you before Shauna gets going, and I go off screen, that if you have questions specifically about the registry, make sure you put them into Q&A right now so we can answer. We'll be answering those. Shauna will be answering those right after she presents.
Great. Thank you so much, Greg. Hi, as Greg mentioned, I'm Shauna Planck. I'm the manager of the Genetic Cardiomyopathy Registry, a patient as well. And if we go to the next slide, I just want to talk a little bit about the registry. Maybe you joined our webinar or have watched the recording from January. Maybe you joined the registry. If not, I just want to have this refresher of what the registry is and what the intent of it is. So really, it's intended to empower eligible individuals with genetic cardiomyopathy to participate, just to help better advance research and hopefully find effective treatments and cures potentially for genetic cardiomyopathy. There are a few things worth noting in the bullet points that you see here. It's an online registry and database for anyone with or at risk for genetic cardiomyopathy. It is sponsored by the DCMF Foundation and its partners, so we serve as a sponsor organization, but it's hosted by NORD, another organization, on their platform called I Am Rare. I'll show a couple of screenshots of that later in case you're not familiar when we get to the section where we talk about how to join the registry. So again, it's really meant to be a database of affected individuals, family members, so that we can help identify research opportunities for people who might be a good match. Another thing worth noting at the bottom there is that the registry itself is not conducting its own research. We would be partnering with other organizations or facilities that are conducting their own research. I'll talk in a minute about what that workflow looks like and how you can opt in if you are somebody who is joining the registry. With that, let's go to the next slide. And Greg mentioned that we just have a couple of commonly asked questions. So they kind of come in three themes, and these are what I'm going to discuss. So number one is who's eligible? What does it mean to meet the eligibility criteria? I'll walk through that. The second one is about data, right? If we're posting this data to a database, it's really important to understand the safety and security measures that we're following to protect your data. So I'll just dive into that briefly. And then lastly, how do you join the registry? Again, I'll show you some screenshots of the I Am Rare platform. And at the very end of tonight's webinar, you'll also have a QR code that will come up on the screen that you can use to scan and get yourself registered as well. But let's go to the next slide and dive into eligibility. So there are a lot of words here. I don't want anyone to get caught up in that. And if after this session you still have any questions, we'll have our email address, and you can always reach out between myself and Dr. Kathy Crispell, who's listening on the line, and she's our principal investigator as well for this study and the registry. We'll help you work through the nuances if you do have further questions about eligibility. But from a broad perspective, it really includes relevant information about your personal or family medical history. So to be eligible, you have to have a diagnosis of cardiomyopathy and have some element of a genetic component, and that can be number one, you see right in the middle there, a genetic test result. So Greg mentioned I'm a lamin patient, so I've had a genetic test myself that shows that I have a variant in the lamin gene. So something like that with a known variant that's associated with cardiomyopathy, and or a suspicious family history. So if you have a cardiomyopathy diagnosis, you haven't undergone genetic testing yet, but you have a suspicious family history, you can see how that's defined. So a first-degree relative, which you see there in parentheses what that means, who has cardiomyopathy as well, or or they have a documented episode of sudden cardiac death at a young age, under 35, or 2 or more non-first degree biological relatives, so aunts, uncles, grandparents, etc. So again, I know this can be nuanced and it can be a little confusing. So if you have questions, certainly don't hesitate to reach out to the email address that you'll see in a couple of slides. But what to know is it's a genetic cardiomyopathy registry. So you need to have the cardiomyopathy diagnosis and then a genetic component as well. And again, we'll walk you through that if needed, but just wanted to clear that up as we've had a few questions about someone who hasn't had genetic testing, whether you can still be eligible, and you can if you meet the other criteria. You also see at the bottom in red a few other notes. I couldn't list them all here, but you also have to be agreeable to signing the consent and then also have periodic internet access. Those are some other criteria that apply towards eligibility, but primarily it's about the medical criteria that we've been getting questions. So hopefully that clears things up. Reach out if it doesn't. And with that, I'd love to move on to the next slide and start talking about data. So we do collect data on these topics that you see bullet pointed. So if you've gone through the process, you'll upload test results, talk about your past medical history, some socio-demographics, what treatments you've had, so we can see, how many people within the registry have had a transplant or have had a VAD implanted or a defibrillator implanted, et cetera, an ablation. So those are some of the questions that you'll be asked once you register. So of course, with that, we have a duty and responsibility to maintain data privacy and make sure that people aren't accessing the data unnecessarily. So if you go to the next slide, I'll talk a little bit more about what that means. So one thing I mentioned at the very beginning when I started speaking was that DCM Foundation itself and the registry are not doing the research, but we'd be communicating with other potential researchers in clinical trials. So I want to talk a little bit about what that process is in case you are in the registry and waiting to hear some notifications about maybe some research that's relevant to you. So how it will work is, number one, a potential researcher or someone who's running a clinical trial will reach out to either myself or Dr. Crispell and say, hey, we have interest, we're working on genetic cardiomyopathy, we'd like to talk about accessing some registry data. So at that time, myself and Dr. Crispell will determine if the researcher or the clinical trial is acceptable to partner with, review what they're working on and all of the other parameters and make sure that it's something that makes sense for our population. At that time, certified GCR staff, so again, that's really me and Dr. Crispell, it's a very small group, we'll kind of search and say, oh, hey, we have this subset of matching participants. So maybe the research is specifically focused on, I'll say lamin A, that's, affects me. So they're really just focused on individuals who have a lamin A mutation. So at that time, we would, evaluate the database and find that group that has that particular lamin A mutation. And lastly, if those participants have opted in, then we would share with those participants, here's the researcher's contact information, and here's what they're working on, maybe a fact sheet or something of the research that they're doing. So I think the important piece to get out of this is opting in. So everybody who signs up for the registry has the option to opt in or opt out of those communications. So, and it's something you choose when you first sign up, and then again, you can change that anytime as you're already registered. So if you have questions about that, you can always reach out and we can walk you through how to opt in or opt out, or verify what you're signed up with. But if you are opted in and we have a match, we will reach out to you and let you know that there's a researcher or clinical trial that may be relevant for your the information that you've provided to us. So with that, let's go to the next slide and just talk a little bit about that access, right? Because you saw there are some people who are accessing the database. What I want to make sure you hear is that it's very limited. So certainly myself and Dr. Crispell, as I've mentioned, we are trained and certified in good clinical practice for social and behavioral research. And so we do have access to this database. There's not anyone else on the DCM Foundation team who will be accessing this data. In rare cases, you see in the second bullet point, some of the NORD staff, we're using their platform. If we have technical support needs or something, they may, with our permission, need to go in and help. But as a whole, it's very important to us to maintain protection for your personal health information. And we'll use only the minimum data that we need to accomplish our goals. And again, we've been trained in what that looks like. So let's go to the next slide, please. I'll talk just one more thing about that. The other thing is that we do have the platform served over HTTPS. So essentially your data is encrypted, and we follow all kind of standard and strict guidelines to make sure that everything is protected since it is living in an online database. So happy to answer any more questions that anybody has related to data. But we wanted to take a minute just to reiterate that this is of utmost importance to us, and we continue to follow best practices along with this. So let's dive into the next slide and talk about how to join. So if you have joined the registry, thank you. We are happy for that, and we encourage you to talk to family members, friends as well, to consider joining the registry if they're eligible as well. If you have not, here's a way that you can do it. So you can go to geneticcardiomyopathy.org. At the top right of the screen, you'll see Join the Registry, a blue button. So you push that, and then it will take you exactly where you need to go. We'll also have a QR code at the end of this presentation, and it will be emailed out afterwards as well. On the next slide, excuse me, you'll see a couple screenshots. I want to take a minute here to pause and talk about the type of account, because when you do go to register, it will ask you which account type you have or you'd like to create. Would you like to create a participant account or a caregiver account? At the bottom right, you'll see there's a button that says, not sure, help me choose. And what will pop up is the secondary menu that you see on the right hand of the slide. And basically what that does is kind of outlines which might be most important for you. One thing that has come up is maybe it's a parent who has a minor child, and both are affected with cardiomyopathy and it's genetic in nature. And so they're both eligible to join the registry. In that case, the parent should make a caregiver account and then can add their child directly from there. But don't worry, it's very easy to change account types. So if you're a participant and then you find out you have a minor child or that you'd like to add, you can always email us and we'll give you step-by-step directions to switch your account. But if you haven't registered yet, and that might be you, caregiver is probably most appropriate. But certainly reach out with any questions. Let's go to the next slide. I mentioned a few times, email for help. We're always here. We'll get back to you as quickly as we can. Patient questions at geneticcardiomyopathy.org is certainly the best way to reach us, and we'll try to reply very quickly and work through any of those nuanced circumstances or anything else that you have. So with that, I know we have a couple of questions. I'll turn it over to you, Greg, to walk us through those.
Yeah, thanks, Shauna. That was great, very informative, and again, thanks so much for your work with us and your help on the registry. We've got a few questions. One of the questions is, if I have a defibrillator and have had septal myectomy, should I participate or am I past that stage? And I'm happy to help you out.
Oh, thank you. No, I'll take a stab. So yes, thank you. Definitely not past that stage. So we also have people who've been transplanted, aren't cardiomyopathy patients anymore, but certainly we welcome you and you would be eligible. Thank you very much for your question.
Yes, thanks. That would be great. Currently, how many are signed up with the registry, and of those, how many have DSP cardiomyopathy?
Yes, so great question. So we're hovering right around 100 participants in the registry, and I can get that information. I can type it back into the chat specifically about DSP as well.
That's great. And again, we're 60 days in, we're getting rolling. Yeah. We're seeing a real steady push, and we have some goals for the end of the year that we'd like to hit, but we see really being a real steady push of people. But again, if you haven't registered, please register. If you have registered, and you have friends and family that would qualify, please let them know about that. Encourage them to register.
Before you move on, Greg, I actually have the answer. We're roughly 8% of the registrants are DSP.
Okay, this is great. will the registry data be shared with participants? And then a follow-up question to that is, for example, can participants see how many participants have a specific mutation?
Thank you. Yes, great questions. And actually, that is something that I wanted to address. So you can't go log into the registry online and say, oh, how many other patients are there or who are they? So number one, you won't be able to ever see names or identifying information about anybody else in the registry. That's something that's been asked. However, we do plan to, especially as our numbers grow, Greg mentioned we're in the infancy here, but as our numbers grow, we do intend to publish aggregate data. So, we just talked about roughly the number that we have and maybe what percentages are associated with various genes that are mutated, for example. We do intend to do that. Or, this percentage has had these certain types of treatments, for example. But we do need to wait until we have pretty big numbers, because if you say, oh, we have one person with this mutation, right, there's a way that could, be identified as an individual. And of course, we're not going to do that. So you won't have access to that data yourself, but watch for our social media or newsletters, down the road later this year. We definitely intend to share some of that aggregate information.
That's great. Thank you. And again, and let us know also like how you might want to see the information. Again, there are, HIPAA, there are IRB sort of constraints that we have to follow, but let us know how you'd like to see the data and what might be helpful to you. And we have a question of which forms of cardiomyopathy would qualify. Does dilated cardiomyopathy qualify?
Thank you. It does. Yes, that is actually our the most common response that we've had in the surveys is dilated cardiomyopathy. But we have a whole list of, I want to say 8 maybe different types of cardiomyopathy. So arrhythmogenic, dilated, hypertrophic, left ventricular noncompaction. So yes, all types of genetic cardiomyopathies are eligible as well.
Yes. And one thing, there's a little add-on to that is, I mean, one of the reasons we have, it's for all types of cardiomyopathy. I think there's approximately 60 genes that cause cardiomyopathy. And the reason, I mean, we're the DCM Foundation, we're GCAC. The reason we created GCAC, the reason we created the Genetic Cardiomyopathy Registry is because it's so interesting. And I think Christy's going to show with the gene-specific groups in a chart is that, you can have a certain gene, she has DSP, and it can be arrhythmogenic, ACM, or it can be or dilated cardiomyopathy. A lot of the genes, genetic cardiomyopathy gene variants can manifest differently to different types of cardiomyopathy. That's why we're sort of saying it's genetic cardiomyopathy and not DCM or HCM or ACM or something like that. So we also have a couple more questions. Hello, I registered but need to change my account type. What's the email address to reach out again?
Thank you. We'll post it at the end, and I'll type it in the chat too if I can. But it's patientquestions@geneticcardiomyopathy.org. I know that's pretty long. I'll type that in an answer to you, and then again, that will also come out in the email. We'll make sure it's there with the link to this recording.
Yeah, interesting. Another great question. So those of us who have been diagnosed but are gene negative or gene elusive, which I think we'll talk about, or VUS, and have no relatives diagnosed, aren't eligible to sign up? Question mark.
Technically, yes, that is correct, because then you'd be missing that genetic component. However, if you have a very unknown significance, we're happy to, again, I mentioned Dr. Crispell, if you want to reach out to that email address and have us, take a look at that, or, we encourage further genetic testing as science catches up and labs catch up, that could change. But at this time, yes, you would not be eligible.
But if you have a family history, significant family history with cardiomyopathy, but maybe you're gene elusive, haven't been able to see it, that'd be great. One last question before we go and move on to Christy. Shauna, are people from outside of the United States eligible to register?
Yes, thank you for asking that. Absolutely. Yes, anyone from anywhere can register. You just need that internet connection. And again, from any country in the world, you can join the registry.
Great, great. Thank you very much.
Thank you.
Appreciate it. Thank you guys for all the questions. Now we'll move on to Christy Johnson to talk about the gene-specific groups that we have. Christy, thanks so much for your help and thanks for being here.
Thank you, and great to see everybody and nice to meet many of you. Again, I'm Christy Johnson, and as Greg mentioned, I am also a patient with the desmoplaskin gene variation or mutation, as whoever likes to call it what, but also very much an advocate and volunteering both with Greg and with SADS, another one of the partner groups, and loving the work that GCAC and all of those groups are doing. So very, very happy to be here and honored to be able to talk to you about gene-specific groups today. So we're going to talk a little bit about the big picture, and then we're going to talk about what they are. And then we're going to talk about why gene-specific groups could be important to you, even if you're gene elusive. So stay tuned for that little comment. And what we are doing right now with our team on gene-specific groups, and then calls to action for you and how you can work with our gene-specific groups. All right, so very first, how do gene-specific groups fit into the big picture? And this is a great diagram because we actually just talked about this, right? Genetic cardiomyopathy has several types under it that can be genetic. It doesn't mean that they are, but very likely they have different percentages of genetic component to each of these types of cardiomyopathy. So ACM, arrhythmogenic cardiomyopathy, DCM, dilated cardiomyopathy, HCM, hypertrophic cardiomyopathy. Now it's going to get tongue twister. LVNC, left ventricular non-compaction cardiomyopathy, and then restrictive cardiomyopathy. But under those are these very pesky, as we know, pathogenic gene mutations or variations that are linked to or cause these types of cardiomyopathies. So next slide, please. I know this is an eyesore, but bear with me for a minute here. I love this diagram, and I wish I had an entire hour, Greg, just so we could talk through it, because I think it's so cool. To me, it was really eye-opening. But just so we can get a little bit of an orientation here, you'll see a lot of genes, right? So these letters in boxes are genes. And the lines to the disease types that you see in circles are the disease types. But the lines that you see are connections between those genes and a certain type of disease. Not all of them are listed here. So just a quick reference, this was created by a dilated cardiomyopathy researcher and has been updated a ton of times because we're learning more and more all the time about genes, right? We're adding new genes. We're changing these lines and adding new lines to new diseases as we learn more and more about them. So this is kind of a point in time picture, but it's, I think, a really cool representation of all the things that pathogenic gene variants can do and cause when it comes to disease. So just really quickly, the genes associated with one phenotype are blue. Those that are associated with two different phenotypes are in red, and those with three, lucky people like Shauna and Greg with Lamin A have three potentially. So, you know, the color is showing how many they've identified again at this point in time. Greg mentioned that I am desmoplaskin, DSP. If you look at the ARVC circle, you can see the DSP above. And he also mentioned that DSP can be an arrhythmogenic cardiomyopathy and a dilated cardiomyopathy. And this was really interesting. I remember when I saw this diagram for the first time, and I don't know if there's others out there like this in your families, but for me, this was an aha moment when I realized that my father died of an arrhythmia in his sleep, and my aunt died of heart failure, and as far as we know, didn't have any arrhythmias, but the DSP gene is on both sides of those families. And I'm actually the proband, but it was so interesting to see that these different manifestations, these different phenotypes can occur potentially in the same family and certainly within one gene. So anyway, I just wanted to explain this. I love this. We can come back to it if anyone has any major questions, but that's the genes and how they relate to diseases. And let's go on and talk more specifically about the gene-specific groups that we have. Next slide, please. All right, so the gene-specific groups are groups of people with the same gene mutation that are known to cause cardiomyopathy. Right now, the DCM Foundation and GCAC are partnering with other groups that are pre-existing, including my own DSP, Cardiomyopathy Support Group, and others. And most of them are on Facebook. Some of them also have other websites as well. And you can find links to all of this on our website. And that little QR code, you can look on that and you can see what those links are and join if you see one that you want to right now, even if you want. But the list is being expanded all the time. And I think this is a key point, that if you don't see your gene up here and you want to help start a group, you can email the info@geneticcardiomyopathy.org or me. My email address is on the next slide. And we definitely want to talk to you about creating new gene-specific groups and hopefully helping us admin those. Next slide, please. So, but why? Okay, so that's nice, you're getting people together in a group, but why? The answer that I have for this is is there anyone else out there like me? And because people have their own individual symptoms and journeys and differences, but there's a lot of common manifestations of disease and symptoms at the gene level. And I found that fascinating. I mean, even some random ones with my gene, more people often have calluses on their hands and feet. Their hair is different sometimes, curlier than mine, but there's a lot. It's very interesting to see some of the commonalities, but they also have very similar manifestations in some ways and journeys. So the purpose really of these gene-specific groups is to get support and educate people that are impacted by a specific gene variant, some of those gene-specific manifestations, and then leverage the experience of others. I mean, I do really wish that when I was diagnosed in 2020, that someone would have said, I've had DSP for 20 years and here's what I've been through. That's all I wanted. And I couldn't find it. And now in these gene-specific groups, we have people willing to share their experiences over multiple years, multiple incidences. And again, everyone's different, but it's really not only reassuring, but helpful to learn about people's experiences in this way. And then we also share genetic therapies and research. So an example, back to DSP, because that's my group, we are having some researchers come from the University of Michigan in April to talk to that gene-specific group about the DSP research that's going on now. And we're hoping to expand a lot of those concepts out into our other gene-specific groups. And next slide, we're going to tell you a little bit how we're going to do that. All right, so we are growing these gene-specific groups in two ways. Number of people, so we want to have more people in those groups, as well as the groups that we said that we haven't created yet, that we still need to create. So we're growing in those two different ways. And we want to educate them. So not only are we having sessions like I just talked about with scientists coming to talk about research, et cetera, but currently we're in a project with the gene-specific groups team. So we definitely need to give kudos to Greg and Stephanie and Nikki and Buddy, who are in this gene-specific groups working on ways to educate and to build out those groups to make them beneficial for patients. And one of those ways is these gene-specific recordings that we're doing right now. We've recorded 5 so far. We have a lot more in the pipeline, and we're asking physician experts these 3 questions. So we're asking them, what are the unique considerations and symptoms for people with, we're going to use mine again, DSP cardiomyopathy in my example. Tell me about disease progression and treatment options for people with DSP cardiomyopathy. And what is the outlook for the future therapies, including genetic cardiomyopathy therapies for now and in the future? And this is really interesting. So we're getting so much insight from these doctors, even in these very short, they're about 5 to 15-minute videos, giving this information. And as people can join the groups and they can learn, very quickly these 3 very common questions and important questions. All right, next slide, please. So the call to action for you is, if you or family member want to join a gene-specific group, please do. They are private. Admins do have to approve you, but family members and people that are impacted by a pathogenic variant, or actually, I'm sorry, any gene variant, are welcome to join the gene-specific groups. Please volunteer to become an admin of your gene-specific group, whether it's existing or new. And you can email me, or you can email the info address as well. Donate to the Dilated Cardiomyopathy Foundation to support some of those videos, for example. We are paying video production to make those really nice videos for people. So that would be an option to give back. Share your ideas and suggestions. So any kind of thoughts that you have to make this program better. We'd love to hear it. So please email me with your ideas and suggestions. And join the Genetic Cardiomyopathy Registry. So giving you, Shauna, and the team a shameless plug here, because it is important at that gene-specific level as well. I mean, we want researchers to know as much as we can at that gene level, especially with genetic therapy, as we can. So I would say join all the registries you can, if possible. Not just one, join them all. But it really is important to join and to give that information so that researchers can access it and make progress on therapies for us. And that is it. I would love to answer some questions.
Yeah, any questions? Does anybody have any questions on the gene specific groups? Because if not, you're going to have to listen to me talk. So, I think, Christy, that was wonderful, and thank you, and thanks for all your work and your expertise, and again with Shauna also. I think one of the things that we're all trying to do here is that we know genetic cardiomyopathy kills a lot of people very deadly. We think there's probably over 1 million people in the country with genetic cardiomyopathy. And we know that they're not being served by the general medical community. We'll go into that a little bit later. But what we're really trying to do with whether it's this or whether it's the gene-specific groups or the registry or genetic testing, which you'll see a little bit later, or any of the programs that we're doing, is to educate patients and also make the patients a key element in actually moving the science, the medical community forward. And we think the more people that get involved, that get genetically tested, that get involved in registries, gene-specific groups, and make some noise, we really think that it would, is going to put pressure on the medical community to better serve us, to help us create or be partners in creating the solution. We do have a question. How do I access the gene-specific videos?
Yes. And Greg, I think that, are we ready to announce a date yet?
Yeah, so I think sometime in May, we'll let everybody know. We'll send an email out. We have your email since you registered today. But excuse the sun, but the sun is finally shining in Ohio, which is a good thing, but not during the webinar. So it'll be in May that we're actually creating a new gene-specific group landing page with all this information. And we'll make sure that we send all this to you when we do go live. So
that's great. Yes. So in May, sure, and we're still gathering those videos and editing them now. The other thing, and I said I was going to do it and I didn't, but we are creating a gene elusive group as part of our gene-specific groups program, because there are some similarities, of course, with our gene elusive folks and conversations that they want to have. So we will also have that group added to the list very soon.
Yes. So I am gene positive, but don't have confirmation of cardiomyopathy. Should I register? And I think there are two questions here. Should I register for a gene-specific group, Facebook group, and or should I register for the Genetic Cardiomyopathy Registry? Christy, maybe take the gene-specific groups.
Sure. So definitely, if you don't have confirmation of the gene, that gene elusive group would be a great place for you to go when we start that. So yes, please join that. And it gives you, I don't want to call it a placeholder. That's not what it is. But I do think things are being discovered daily almost when it comes to impacts for disease.
Yeah. And I do think, and if you have not been formally diagnosed with cardiomyopathy, but you've been diagnosed with gene cardiomyopathy, very positive. Sorry. Yeah, no worries. I didn't say that.
I looked at the wrong question. Yeah. I apologize. So yes, for gene positive, you don't have confirmation. Yes, sorry, apologies. You should definitely register for the gene that you've tested positive for, especially if it's pathogenic. If it's something that is unknown, I mean, that's up to you whether or not you want information on it. And you definitely should continue to be tested as your doctor advises, but join the gene-specific group if you don't have cardiomyopathy yet, but have tested positive. Absolutely.
Yes, great. And then with Shauna, I mean, I'll answer for you, but yes, you also, anybody that's tested positive for a gene variant or mutation in cardiomyopathy could and should register for the Genetic Cardiomyopathy Registry. even if you yet are not, you haven't been diagnosed or aren't seeing symptoms of the gene mutation or cardiomyopathy yet. What do you know about DSP gene mutation? And let me tell you, Christy knows a lot. Genetic research therapy ? I have a LACM for DSP mutation, and my 4-year-old daughter is a carrier. And Christy, do you want to take a shot at this? We are not medical doctors. We are not genetic counselors. So it's, again, I should always say that we don't want to go too deep into the science. But, you know, what do you want to take a shot at that, Christy?
So a couple of things, I think. So the first one is, please, if you have not already joined the DSP Cardiomyopathy Support Group, please do. Again, we're having a leading research team come speak with us in April about their DSP research lab and the other things that are going on currently with DSP research. So I would definitely ask you to come to that. I know that it's autosomal dominant, right? So just like a lot of these things, the DSP gene mutation is an autosomal dominant gene, which means that you have every offspring of somebody who does have the gene has a 50% chance of having the gene. So in my family, for example, I have 2 daughters actually, and one of them has it, one of them does not. So your daughter, who technically is a carrier, does have the gene. You might not see development of disease in her now, and you probably won't, as a lot of people don't develop any kind of symptom or even imaging until a little bit later than that. Some are older children. I didn't even actually show it on my MRI until after I had an arrhythmia, and they went back and had to try to find it. It was really challenging. So it is something that is autosomal dominant. And so I don't know about the word carrier. If she's positive for the gene, she has the gene mutation, but she may or may not ever develop the disease. And I think that's the key thing. And I also would say genetic counselors are great resources in this way as well. But if you ever want to talk, you're absolutely welcome to contact me on Facebook as well. I definitely talk to people who have the condition. So thank you.
Thank you. Last question, is Titin the most common? So I do know Titin is the most common gene for dilated cardiomyopathy. I am not sure about all types of cardiomyopathy, but I know it's about 10 to 20% of all dilated cardiomyopathy gene, people with the gene variant, 10 to 20% have the actual Titin variant. As I understand it, is the most common for dilated cardiomyopathy. So thank you for that. Thanks everybody. Again, thanks Christy and Justine. Let's go to now it's me. You all know who I am. Next slide, please. So again, we've asked you to participate in the registry. We've asked you to participate in the gene-specific groups. And now we're sort of asking you, how do you spread the word on what we're doing? Again, I think everything that we're doing is trying to get patients identified, more involved, and advocates to the general community and also the medical community. And so we need your help. We need your help in spreading the message about genetics and cardiomyopathy. And so to help us get the message out, we created a group called the Advocacy Army. And what you can do is simply go to the www.geneticcardiomyopathy.org, click on Patient Support and Advocacy. And then once you're on that, click on Join the Fight. And sign up for the Advocacy Army with your name and email address. As it says here, by signing up for the Advocacy Army, you will receive an access to our toolkit filled with information that you can share with patients, family, friends, and medical community. We think that's really, really helpful. And again, that is constantly being upgraded, changed, added. So by becoming part of the Advocacy Army, you can help us spread the word. Next slide, please. In the toolkit for the Advocacy Army, it includes informational PDFs that you can send not only to potential patients, family members, friends, but there's also some PDFs that you could actually send to your doctor. Most docs and most cardiologists don't understand much, if anything, about genetic cardiomyopathy. And we'll get into that a little bit later. There's also videos, and there's the woman that runs our Dilated Cardiomyopathy Facebook groups and is the admin and runs a lot of our gene-specific groups, Stephanie Fallon. We have videos that you can share. And there's also social media graphics and sample posts that we can give you. So again, we really encourage, we want to make this viral. We want you guys to support what we're doing and go out and tell the world. And also you can go to info.geneticcardiomyopathy.org if you'd like to get more involved. Sign up for the Advocacy Army, as I just mentioned. But if you want to get more involved, you can go to info.geneticcardiomyopathy.org. And we can have a conversation about how you might want to help and support us better. Next slide, please. Here are some ways that you can help spread the word. And again, I am not a real social media guy, almost 61-year-old guy, tend not to be, but we see a lot of people that aren't real huge social media folks that are actually helping us spread the word. It's pretty simple. You can like our Facebook page, and you can see the address of our Facebook page there. You can follow us on Instagram. Share our posts in your feed. If you see a post that you like, share it in your own feed. Again, share your post in cardiomyopathy-related Facebook groups. Make your own personal posts using provided images, videos, and messages. And print and share our PDFs with your cardiologist's office or heart failure center, and ask them to be made available for cardiomyopathy patients. And you can share via email the PDF, online, or you can actually print it and take them some copies if you'd like. Attend our webinars like you are here today. Great. Thanks so much for being here for everyone tonight. Sign up for emails if you haven't at geneticcardiomyopathy.org/signup/. And again, have conversations with your family and encourage them to get genetically tested. What we tend to find, patients and families that do best, they have a matriarch or a patriarch that keeps people informed, that keeps people accountable. Have you been, maybe you have a positive variant and you're not sick yet. You need to get EKGs, you need to get echoes, you need to be seen every year or two, followed up by a cardiologist. Are you taking your meds, right? So be that matriarch or patriarch in your family that actually can, be a positive, help keep your family alive and help keep them healthy. Next slide, please. The next thing we want to talk about, after spreading the word, is some helpful pointers on getting the best care. And you'll see some of our social media ads is an ongoing campaign that we will continue to do. So to get the best care, when diagnosed with cardiomyopathy or heart failure, there are several key factors you need to consider. You want to make sure, at the very, very least, you are seeing a cardiologist for your treatment. If at all possible, don't go to a general practitioner, but you want to go to a certified cardiologist for your treatment. And if you're having any arrhythmias or any issues or electrical activities with your heart, you want to make sure that you are also, the cardiologists can do a lot of things. For heart failure, they tend to treat the muscle. The electrophysiologist was actually highly skilled and highly trained to be able to work with you and understand the electrical system and any arrhythmias that you might having. And what we do tend to find, my belief is, this is my personal opinion, is that most cardiologists aren't real well trained in heart failure. I'd say at the corner cardiologist, sometimes small hospital settings. But in order to get the best care, we really believe that you need to go to a heart failure center or heart transplant center. They almost always have expert care that if they can't treat you very well, they have the knowledge of where to send you. It's really simple. So if you have been diagnosed with cardiomyopathy, go to Google and simply type in either heart failure center near me or heart transplant center near me. There's close to 150 heart transplant centers across the United States. They're normally associated with an academic medical center. You're going to get the best treatment there, in my opinion. And again, if they don't know what caused your cardiomyopathy and they diagnose you, it would be called, they diagnose you as idiopathic or non-ischemic cardiomyopathy, were you offered genetic testing? It's really, really important. The guidelines are that if you have been diagnosed with cardiomyopathy and it's an idiopathic or non-ischemic diagnosis, means we have no idea where it came from, all the key guidelines for the American Heart Association, American College of Cardiology, and the Heart Failure Society of America say you should be genetically tested. So strongly ask your medical team for that. Next slide, please. So that's the medical side. There are also 3 other sides I'm going to talk about: physically, emotionally, and financially, that when you're diagnosed with cardiomyopathy, you need to consider, and we want to talk about physically right now. What should you do? So once you've been diagnosed and you feel comfortable that you're with the right medical team, you also need to take care of yourself. 3 simple things here with a subpoints under 3. Are you taking the medications and therapies that are prescribed by our medical team? That's really, really important, guys. You need to make sure that you're doing what your medical team says. The other thing is, are you communicating with your team on how you're feeling and any drug side effects? It's really important if you have this disease. If you're feeling bad for a few days, you let the team know. Or if you're feeling something that might be considered drug side effects, that you let the team know. Constant communication with your team when you have cardiomyopathy or heart failure is really, really important. And also, are you taking care of yourself physically? Again, genetic cardiomyopathy, being sick, having heart failure, worsening, having electrical issues, having a heart transplant, it's really important that while you're sick, is that in order to fight the disease the best that you can, that you're taking care of yourself physically. That's eating well and watching your weight, limiting stress where possible, wherever you can. Again, stress is not an outside influence, it's a self-inflicted from the inside. So limit your stress, exercise, and stay as healthy as you can under a doctor's supervision, and make sure you get ample sleep. These people that think that not getting enough sleep is a badge of honor, that stuff kills you. You need to get as much sleep, especially if you're battling a disease like this. Next slide, Justine, please. So it's also emotionally or mentally, right? How do you take care of yourself? As I know, cardiomyopathy, heart failure, and going through it, especially over a prolonged period of time, can be very stressful and at times debilitating. So you should always seek support of others, and this should be a must. Don't try to do it on your own. I thought I was a tough guy, all that stuff, but it's a recipe for failure. You need family and friends. You need a strong family and friend network to be able to lean on, support on people. When you're having a bad day, you don't have to harp and complain all the time. Let them know. When you're having a good day, celebrate with them. Also, get involved if there's any community or religious groups, whether you attend a church or synagogue or mosque, or belong to any community groups. Staying involved is one way not to collapse upon yourself emotionally when dealing with a disease like this. And also, speaking with a trained therapist. It is hard emotionally to get through this. I have worked with a trained psychologist for many years. I still do. And I think that is an important part of my care when I first got sick, when I was on my way to transplant, the way up. And now that I feel great, feel wonderful, I still think it's a very important and necessary part of my care. Next slide, please. Last but not least is financially. Again, this disease can also cause a financial burden, as many of you or all of you know that's diagnosed. A few quick tips to help you deal with this. I would say, make sure, again, health insurance is key. In this society, not everybody has health insurance, and not everybody has good health insurance. So look at your health insurance plan and make sure you have a good health insurance policy if possible. And also, when switching jobs, a lot of people I know are looking to get the highest compensation, hourly rate, annual salary, but it's really, really important that you have very good health insurance and that you make it a priority when taking a new job. Really go through that health insurance or or the benefits package to make sure, because again, with out-of-pocket, lack of insurance, bad health insurance, it can ruin you financially. Really, really important. Also, are you saving for annual out-of-pocket expenses? Most plans, even the good plans, have pretty large annual out-of-pocket expenses. When you're sick, you have a lot of expenses. You take a lot of medications. You have to take a lot of tests. So make sure that you are saving, because you will have fairly significant annual out-of-pocket expenses. And the last thing is, are you getting the best price on your medication? And some of the ways to do this. So for most medications, especially expensive medications, there's manufacturing coupons. So for instance, Entresto, I use this as an example from Novartis. I was able for a year or maybe even longer to get the medication for like $10 a month. The companies that manufacture the drugs, have lots of times programs to help assist in payment. Also, are you shopping for pharmacies for pricing? Really important. Even if you'd like to use one pharmacy all the time, if a copay or a drug comes back as very expensive, look at other pharmacies for pricing and explore drug discount programs like GoodRx, Cost Plus Drugs, Amazon. There's a lot of things out there where you can get more affordable pricing on medications. You constantly have to be looking at that. Next slide, please. We're going to do a quick Q&A. We may run a few minutes over. If you have to leave, we understand. But we do have a few questions that I want to get through. And from Ravi, are there any costs associated with participating in any of the studies greenlighted through the consortium? There are not any costs. We will not work with anybody that charges a patient to participate. If for some reason anyone has ever approached you about charging you money and participating in any of the programs that are sponsored by the Genetic Cardiomyopathy or GCAC, let us know, because that should not be the case. We also have, and this is kind of from Taylor. Hey, Taylor, hope you're doing well. I've been debating about coming out, so to speak, as having cardiomyopathy in my digital identity for many years. At first, I kept quiet at work, but then felt a lot of relief when I could share a little bit about it. My fear about coming out is the impact it may have on my career trajectory. Can you comment with perspectives about coming out online as a cardiomyopathy patient and ideas for making a framework for making a decision to do this? Actually, wonderful comment and question, Taylor. Yeah, I mean, we've talked to a lot of people that have had that. And that's really a personal decision if you think it will hurt your career. We actually had a board member that was concerned about with his clients and his career. Very similar, very common. I think that's an individual perspective. But really, as you understand, if you can do your work and you're doing it well and a productive citizen, the reality is everybody's got their stuff they're dealing with. And if you talk about it with other people, it's amazing how many people might say, yeah, I understand that. My father had that. Or I'm actually dealing with an autoimmune disease. When I publicly went, after I was diagnosed, that I had this disease, it actually created a safe zone for coworkers and people to say, yeah, I've got this, I have that, I have that. And that doesn't mean that anybody that is battling any disease cannot be a productive citizen and a productive employee. I think it's really, really important, but it kind of creates a safe space for other people. You actually may be support for others in your workplace that are battling something and just want a safe shoulder to lean on and talk about. So I think that's really important. But again, there could be some risks, and it's a decision up to you. Diana says, I had genetic testing done, but I still feel clueless. How often is genetic testing recommended? So they sort of say every 3 to 5 years. We're going to talk about free genetic testing service coming out in a couple slides here. We're going to have a webinar in May about it. But we also recommend that anybody that get tested, if they've been tested before and you have questions, the test that we're doing will actually have genetic counseling associated with it. So anybody that's been tested wants to get retested, we recommend it. We're going to offer a free service starting towards the end of May, we'll tell you about in a few minutes. And it's important that if you have a positive gene variant, that you talk with a genetic counselor to really understand what's going on, to talk about what might be the next step for you, and obviously the next step for your family. I'm going anonymous attendee. I'm going back and forth with sharing my diagnosis because there's so much information about there, and sometimes I'd rather not to share. My question is, can I opt out of the registry if down the line I change my mind about participating? Shauna, we'll take that for you.
Yes, thank you for the question. And two pieces. Yes, you can. So one, you can change your consent so you do not consent to participate. The other is because you use the word opt out, you can remain as part of the registry, but opt out of any communications related to relevant research. So we would not reach out, but you would remain in the registry, or you can completely remove your consent from participating in the registry. You can do that anytime yourself in the portal or by emailing us, and we can do that for you on our end.
Yeah, super. And Pam, thanks for the kudos on great information. Next slide, please. We're almost there. Again, we'd like to thank our generous sponsors who make all this possible. As you can see, the list continues to grow. We're getting more and more partners. And I'd also would like to say, there are 20 to 25 companies that I know of that have genetic cardiomyopathy drug therapy pipelines. Doesn't mean it's coming tomorrow. It's coming soon. Doesn't mean that it will all be successful. But I look at the number of companies we're working with, the number of people. There is hope, guys. There is hope for the future. And potential therapies, especially, improved therapies for general cardiomyopathy and also for genetic cardiomyopathy are coming. There's a lot of really, really bright, sharp people, well-funded all over the world that are working on it. So there is hope on the horizon. Next slide. So webinar recording and the Genetic Cardiomyopathy registration link will be sent in the next few days. Watch for a follow-up email, including recording for tonight's webinar, a registration link to join the Genetic Cardiomyopathy Registry, and a link to join the gene-specific groups. Next slide. Again, to sign up for the registry, I think we've seen this a few times. If you want to take your phone out and scan this, that's great. Feel free to join. Or just go to www.geneticcardiomyopathy.org/registry. Next slide. Again, upcoming webinar we talked about, I believe it's going to be May 28th right now. Don't quote me on that, but it's probably going to be later May. We are going to have a webinar about announcing a free genetic testing and genetic counseling program for patients diagnosed with idiopathic or non-ischemic cardiomyopathy, and for any patients that have tested positive for genetic cardiomyopathy variant and would like to be retested. So we're going to use that as the launch campaign for this free genetic testing program. And so watch for in the next few weeks on the webinar information, sign up for the webinar. We then will give you all the links, the information about registering. And then you during the webinar or after the webinar can go on and sign up for the free genetic testing. Next slide. Perfect. That's it. Again, would love to thank Justine behind the scenes. Would love to thank Nikki, Buddy, for their help in putting this together. And thank you so much, Shauna and Christy, for the wonderful presentation. Thank you all for attending, and all the patients, medical professionals, and pharma companies, pharma biotech companies that support us and are helping us grow and get the message out. Everybody have a wonderful evening, and we'll see you in about 2 months at our next webinar. Thanks.